Well, howdy YouTube family, it is Bolt CRNA coming to you with another day's topic. Now, today we're going to be talking about what kind of boss do you have as a CRNA. So it's a different role professionally, and do you still have a boss? And if you do, what is that kind of role like? Is that like having a nurse manager, or what does that look like for a CRNA? So let's get into that. Now, the first thing that you're going to recognize when you become a CRNA is that you don't have a technical boss or manager. You're probably going to have someone called a chief or a lead or the medical director of a group. Because now you're considered a part of a group. You're not necessarily an employee that works on the unit or something like that. You are a part of a group for the most part. Now, there's different dynamics and environments you can work in as a CRNA. Some CRNAs work in anesthesia care teams, which are usually at bigger hospitals, and they have multiple different levels of leadership and different roles that people play in, and sometimes there might be 150 people, 200 people or more in the anesthesia group total. And then there are other groups that are more mid-sized, 50 anesthesia providers in the whole group, and it's much more of just one chief and maybe one medical director of the group, and then there might be a couple other ancillary leadership roles, and then everyone else just kind of works within that. And then there's even smaller groups where it's like a partnership, like everyone who is part of the group, it's 10 or 12 of you who work in a group. It could be CRNA only, could be a mixed collaborative group with CRNAs and physicians, but everyone is purchased in and has part ownership over that group. And then in that sense, no one is really the chief or in charge necessarily, and everyone is just kind of working together as a group and coming together, you know, every so often for meetings to talk about the way things are progressing, but everyone kind of is purchased in and put money forward to be part of the partnership in this group. So there's lots of different dynamics you can work within as a CRNA. It just depends on what you want to do and what's your preference. But let's discuss, what is it like to have a boss as a CRNA? Luckily, as a CRNA, you're going to have finished your doctorate degree, you're going to have a high level of autonomy, and you're going to be highly specialized and skilled in what you do. And that usually is reciprocated in the position of whatever role you're working in, with some autonomy and with some respect within the group. So it's not the same when you work as an RN and you're kind of talked down to a lot. You're kind of being told by lots of different levels of management what you can do, where you can go, what times you're going to be working, when you need to be working weekends. Everything is very micromanaged, and the minute you do something out of line, you get your hand slapped and you get written up, and it just feels like, as someone who worked for 4 years as an RN, I can just tell you, it feels like you're always on edge of being in the wrong and always being told, you know, this needs to be completed, this education thing has to be done. There's lots of just tasks, and I remember on the unit one time, the nurse managers decided that we were less productive because we had chairs on the unit. So the hospital administration decided they were going to take away all the chairs from the unit, and we would just stand at all times, and we would just chart standing. We would go to the patient's bedside standing. We would just stay at the bedside outside the patient's room at all times standing, no chairs. And there were a couple chairs around the unit, but if you were sitting in them, sometimes the nurse managers would come roam around the unit, and if they saw you sitting in them for more than a couple minutes, they'd be like, what are you doing over here? So that level of just ridiculousness that you don't see, thank God, anymore as a CRNA. You're going to have probably a chief CRNA in your group who mostly their role is to speak for the group of CRNAs. If there's CRNAs and physicians working together, the chief CRNA will be speaking in meetings and stuff for the CRNAs of the group as a whole, and then the physicians will have a chief MD who is picked amongst them, who speaks for all of them as a whole, and they kind of represent their best interests, hopefully, of the group. Especially if there's 50 CRNAs and 50 physicians, all 50 people can't all be speaking at the same time at meetings and all trying to put forward ideas and you know, new concepts about the way things should be done or what best interests these people. So it makes sense that you elect someone who's going to be the chief over that. So yeah, they serve in the chief role, and they usually will once a year be doing your annual review, and that's where they're going to go over your performance. And you've had something similar to that, I'm sure, as a nurse, where they go over things like that. But it's I would say it's much more professional. And in fact, my annual reviews when I did work for anesthesia groups, oftentimes they would ask me to review myself and to go over things that I felt I did well through the year, projects that I completed, things that I feel are my strengths, things that I feel like were weaknesses that I could work on. And they just kind of ask you, like, what do you think about your own self and performance? And then you fill all of that out, and then you discuss it once a year with the chief. And they will say, hey, I agree, or I see that you want to do more of these types of skills, or you're saying you're feeling like you're more weak in your OB anesthesia. So let me facilitate you getting into more OB type roles, or whatever that may be. In a very rare situation, there might be, a discussion about things that you're lacking or not doing as well in, but I find that is very few and far between as a CRNA that they would discuss that type of stuff. Usually you self-regulate as a person in this kind of role. If you already know you're not doing very well at something, you're probably going to know that, and you're probably going to be working on it. It's pretty unusual for them to have to come to you and say, hey, we need you to do this changes. This is not good. The other thing to keep in mind is that it's never a dictatorship. If you do find that you're in some kind of group where there seems to be dictatorship type leadership and they're not listening to the people in the group, and you're putting forth thoughts or concerns you have and you're being told to be quiet or something like that, that's a toxic group. I mean, I'm sorry, it's just not a good group, and it sounds like you're in a bad situation. I would consider leaving, or consider trying to be a change agent for that group. But yeah, in general, I've worked for, I don't know, 5 different groups in my time as a CRNA, and I would say I really only experienced one environment where I felt like it became dictatorship type situation. And that was with a newer hospital group that was not familiar with CRNAs, and they were being introduced in, and there was just a lot of unknown factors with that. And I knew that going in, and I was only per diem for that group, and I just chose not to continue working per diem for them. So in general, you're not going to experience that. It's much more refreshing to be in a CRNA position where usually your bosses are really just leaders of your team, and they typically have your best interest, or the group of you as a whole best interest at heart. Of course, there are always going to be metrics that people are trying to keep up with, and if like infection prevention numbers are not looking good or other things are happening, that's going to get brought up in meetings. Typically, you have meetings at least once a month, and they're going to talk. The leaders of the group are going to be discussing to all of you about what you should be doing differently, or maybe some things that you're doing really well, praise that you're getting from maybe certain surgeons that are really happy to work with our team members and stuff. In general, it's like that. And usually there's coffee and food catered in. It's usually a fairly decent time where, and of course you're being paid for your time to be there in the meeting as well. So it's not so bad. And I like that communication. Oftentimes there's educational moments where they'll bring it up in these meetings once a month, where they'll say, hey, let's talk a little bit more about this new type of nerve block that we're discussing and that we're using, and let's talk about the anatomy and physiology behind it. And oftentimes they'll elect one person in the group who feels most confident in this material, who wants to do the research on it beforehand. They'll do a presentation and they'll present. And so sometimes if you're the type of person that likes these types of roles, it's very easy to be volunteered to do some research on these types of things and present to the whole group. You don't have to be the chief or anything like that. In fact, they prefer that every normal staff person gets involved in some way here or there. And it's kind of probably be pushed upon you one way or the other. So it's best to volunteer on the topics that you enjoy, and then be involved in leadership in the ways that you feel comfortable. So yeah, that is essentially what it is like as a CRNA who works in groups, who has a boss. It's a much more loose, collaborative, professional kind of way to deal with being in a group, and to not have like a nurse manager who's dictating everything and quite frankly, a lot of times just being unfair. Do I prefer to work on my own? Yes. So I work independently. I do 1099 work, and I'm my own boss. And that's the way I like it. It's kind of fun to have a group dynamic sometimes, but me personally, I just, at this point in my career and life, I personally prefer to completely control my own schedule, what I do, when I do it, the days I work, when I go on vacation. All of these things are things that in a group, you have to deal with the group dynamics of what everyone else is doing because people have to be there to provide anesthesia. So for me personally, I would rather just take on the cons of being 1099 along with the pros of being my own boss and managing everything myself, paying for my own 401k, paying for my own health insurance, paying my own malpractice insurance, all the things that your group usually covers. I cover that on my own, but the good news is I am my own boss. So as a CRNA, if you don't like having a boss in any form, then you can always work independently like I do and many other CRNAs do. So that is everything, guys. That is my video on being a CRNA and what it's like to have bosses, or do you have to have a boss? Do you need one? And if not, do you want to do 1099? There's always those options. So hit me up in the comments below on your thoughts on being a CRNA and what it's like having a boss, and times that you've been an RN and had bosses and some experiences of that, because that I've got a lot of stories on. But if you want to hit the like button for me, subscribe and come back because I've got some new videos coming out soon. And follow me on Instagram and TikTok. It's Bolt CRNA over there. Until next time, that's Bolt out.